Good day, everyone. Hello, and welcome to yet again another WAS webinar. So, today is actually the first WAS webinar of 2026. So, welcome to the first webinar of WAS in 2026. And this one is from our Sexuality Education Committee. And our topic for today is insights and trends in out of school comprehensive sexuality education, specifically focusing on Eastern European and the Central Asia region. My name is Renee de Klerk, and I'm the Executive Director of WAS. I am delighted to welcome all of you. Please tell us in the chat where you are from so that we can see where people are joining us from all over the world. Usually, we see people from more than 100 countries sometimes join us in a WAS webinar, which is absolutely wonderful. I'm joining you today from South Africa, where I work and live. And I would like to share with you a little bit about WAS. WAS is dedicated to advancing sexual health rights, justice, and pleasure for all. And through our webinars, we aim to share knowledge, encourage discussions, and engage with experts worldwide on critical issues affecting sexual health. So before we begin today, I would like to just go through a little bit of housekeeping rules. The views shared today are those of our speakers and may not necessarily reflect the official position of WAS. We follow the WAS Sexual Rights Declaration. Our information is evidence-based, inclusive, and culturally sensitive. Captions are available and live translation is available in multiple languages. Please select your preferred language using the interpretation button to see the captions. We encourage engagement. Of course, we want people to ask interesting questions to our panelists. Please use the Q&A box for that, and we'll try to answer as many questions as possible. WAS promotes informed, healthy, and positive sexual behaviors for all. A recording of this webinar will be available and shared via the WAS newsletter after the event. And if you have not subscribed to our newsletter, please do so. And I also would like to encourage you to seriously consider becoming a WAS member if you are not a WAS member yet. So please don't forget to visit the WAS events page and to read more about the upcoming events in your region. I am now going to introduce you to Esther Corona, our Vice President. I don't know if she still needs any introductions. As you might have seen in the pre-roll, she is world famous when it comes to comprehensive sexuality education, and she spent her entire life working in this field, and she recently won the most prestigious award at ICFP, the Luminary Award, and we are very proud of Esther, and we are proud that she's our Vice President and still serving WAS over so many years. Thank you, Esther, for joining us today.
Thank you very much. Thank you for the introduction. And I cannot tell you how excited I am about this webinar because coming from such a vast and vibrant region as Eastern Europe and Central Asia that we don't often hear about. So I'm particularly very excited, and also about the group of people that have been gathered to talk to you, and all these experts I'm sure are fabulous, and I'm very happy to introduce them briefly to you. The full bios will appear in the chat section. So we have today with us Andrei Poshtaruk. And please excuse me for my um, for my spelling or anything, but it's interesting. I don't speak any of the Slavic languages or Central Asian languages, so it's a little bit difficult for me. But Andrei Posteruk, he is the United Nations Population Fund (UNFPA) regional advisor on HIV and youth. He has more than 25 years of country, regional, and global experience in the development, implementation, monitoring, and evaluation of youth and HIV programs. Um, I I can say from experience, because he was recently in Mexico, that his information is so interesting and so so vast that we are very happy to have you here with us. So welcome, Andre, back. I'm still in Mexico City, so welcome through the uh, through the waves and vibes in to this webinar. We also have today with us Elizabeth Schroeder. There she is. Can you please wave to us, Elizabeth? Thank you. Um, Elizabeth, we are very fortunate that she's one of our main consultants and has recently engaged in a very extensive research on out of school CSE. So, Elizabeth is an award winning educator, facilitator, consultant. She's everything. And I can tell you again from experience how marvelous it is working with Elizabeth, because she brings such an incredible experience in so many countries all over the world. So we will ask her today to sort of comment and set uh, Eastern European and Central um, Asia experience within her worldwide experience. Elizabeth, welcome to be with us. Natalia Sarashvili from Georgia. She's United Nations UNFPA program analyst. She's she has 20 years of experience in the UN system to advance the ICPD agenda and work in sexual reproductive health and rights. So also she's a medical doctor as well as um, uh, also a master in public health. She's committed to equity and leave no one behind uh, principle. She works to strengthen health systems and promote inclusive, rights-based services that improve the lives of the most vulnerable. So, uh, Natalia, Natasha, thank you for being with us today. Um, very, I'm very happy to get to know you at least through the screen. Thank you very much. And last but not least, of course, is Yana Pamfilova from Ukraine. She is a youth advocate from Kiev, Ukraine. Uh, and Yana has served as the chair of the board of Teenagizer, which is the Union of Adolescents and Youth, and is the founder of the Eurasian Union of Adolescents and Youth. Um, she has, for more than 7 years, worked on and focused on supporting and protecting the rights of vulnerable adolescents across Eastern Europe and Central Asia. She is also the author of a report on the key barriers to HIV testing for adolescents in the region. Um, Yana, again, we are so happy to have you because you bring to us the youth voices, which we uh, not only need to hear but to engage fully in our work. So, Yana, thank you for all that you're doing, and welcome to the webinar. So, thank you again, and we are now going to go into a round of uh, um, questions. So, but before we do that, I'm going to ask Elizabeth to give us a brief background on out of school CSC, to tell us why it matters, and just frame the discussion that we will later have. So, 5 minutes to you, Elizabeth. Thank you.
Thank you so much, Esther, and thank you, fellow panelists, dear colleagues, for taking your time and being on this call. I imagine that if you are at this webinar, you recognize how vitally important out-of-school CSE is now more than ever, given what is going on globally. It's always been important, but particularly important now. I think if I were going to say there were two themes in particular that we have found in our work out in different countries and different communities, as well as our work reviewing the recent literature related to out-of-school CSE, these two themes would be opportunities and creativity. What we really found in terms of looking at what's been going on with out-of-school CSE over the last few years, everything has been dramatically impacted by what happened in 2020 and the years that followed with the COVID-19 pandemic. Because we are creative professionals and our colleagues and the folks we work with are creative professionals, we were flexible. Schools shut down, communities shut down, the world shut down, but that didn't stop professionals from trying to figure out how do we still reach the most marginalized, the most left behind young people, some of whom were in additionally unsafe situations because of the shutdown. For some of us, we were safe thanks to the shutdown. Other young people were much more vulnerable because of what was going on. So I'll come back to the COVID-19 pandemic and how that had an impact. One of the things we know from out-of-school CSE is that it tends to be done out in the community, sometimes on school grounds in after-school programs, and sometimes out in community-based settings. If you know comprehensive sexuality education, you know that the international guidances by UNFPA and WAS and other UN entities has certain characteristics of what is considered CSE. So it is a curriculum-based approach in a group setting, and all of those are in the international guidances. And even though it is difficult sometimes in the community to get a group together and to get lots of folks to stay on for an ongoing process, many countries around the world, especially in Eastern Europe and in the region that we are going to hear from our colleagues in Central Asia and Eastern Europe, will share that much is being done. One particular finding that we found is there are so many creative linkages being made between programmatic areas. I think historically we have seen a call for linkages between CSE and sexual and reproductive health programming, which remains very important and remains a high priority. At the same time, what we are seeing are much more intentional partnerships and opportunities for CSE to have an impact on things like ending child marriage and gender-based violence prevention and gender transformative approaches and many other important programmatic areas where we can really reach the most vulnerable young people. That includes, as many of us know, young people who, again, are not in school, young people who may be engaging in sex work, young people who may be in humanitarian settings, are in war-torn areas that are all around the world right now, as well as young people with disabilities, young people who identify as LGBTQ+. young people living with HIV, and the many other young people many of whom are just vulnerable because they're younger. And even though we know and believe that they have the rights to access sexual health information, they don't always get to exercise that right depending on where they live. One of the things that we also discovered is that because of the COVID-19 pandemic, we started as professionals around the world, often led by young people themselves, because we should have them lead, is the use of technology. So one of the things that you will hear is how technology has been used to reach young people and to complement what is considered more comprehensive sexuality education. There are only a few programs that we learned about that really could be considered comprehensive sexuality education in online or digital spaces. At the same time, however, young people are living online. They are living through apps. They are communicating using WhatsApp and other kinds of online technologies. So one of the key finding that we would like to share with folks is it is vitally important to work with young people who are far more fluent in how to use technology in general, let alone with comprehensive sexuality education and sexual and reproductive health than we are as adults. Really engage to say, how can we strengthen what we do in person? How can we use it to increase and expand our reach with young people in the most vulnerable areas? And there are many creative ways that I hope our colleagues in Eastern Europe and Central Asia will speak about. And then the second thing I will just lift up, and then I'll pass it back to you, Esther, is how important it is for us as a global community to document the work we are doing. I think oftentimes people think it must be a journal article. We don't have the staffing or the capacity to publish an article. We've never published before. That's not as necessary. It's very important. We want to expand the peer-reviewed literature about our work, but what's most important is to record the incredible and impactful work that is being done around the world, including monitoring and evaluation efforts, whether those are basic efforts or more widespread efforts. So we really encourage colleagues on this call and to share with other colleagues who are not here on this webinar to document what they're doing so that we can share it with each other. There are many, many lessons from around the world that can be used, even if you're in a different region than what is and who is represented on this particular webinar. So with that, and there's much more to discuss, I think I'll turn it back to you, Esther, unless you have any questions for me or anything else you'd like me to highlight.
Thank you very much, Elizabeth, and thank you for highlighting and stressing the importance of keeping records and recording what you are doing. And let us know what you are doing. You don't need to publish very scholarly articles or anything of the sort, but share what you're doing. And sometimes records of what you're doing, evaluations, etc., are kept in drawers. Share them with us, with everyone, because we will be learning a lot of what you're doing. Now I will turn to Andre. You, as a regional advisor, have a broad understanding of out-of-school CSC in such a vast and exciting and diverse region as Eastern Europe and Central Asia. Can you please give us a brief overview of the work that you do in the region? Thank you. You have 5 minutes. Thank you.
Thank you. Thank you very much, Esther, Renee, and the whole WAS team for the introduction and also for having me. And I want to welcome everyone who joined this meeting today across different time zones. I appreciate that. And yes, I am delighted to shed some light on what UNFPA is doing in our region when it comes to out-of-school CSE. When we talk about sexuality education, first of all, many of us think about the classroom, the teacher, textbooks, students sitting at the desks. But at least for Eastern Europe and Central Asia, if we rely only on classrooms, we're going to fail millions of young people. Some context to put in perspective for us to understand, what we're talking about when we discuss ICA region. We are operating in the region with one of the highest rates of growth of HIV epidemic still. We are seeing rising rates of STIs and persistent challenges with adolescent pregnancies. The reality is that for many young people, especially those from marginalized communities, those living with disabilities, those displaced by conflict in our region, the school door is often closed. Or the curriculum inside is quite silent on the issues that matter most for them, for their health, for their dignity. So today I want to touch on how UNFPA is moving beyond the classrooms. And I want to discuss the critical importance of the out-of-school CSC for our region and how we as UNFPA are innovating to reach the furthest behind. And I want to be very honest when we talk about the context of ICA region and what do we face. The context is quite complex. First, the political and social climate. In many of our countries, there is a significant resistance to sexuality education. Misinformation campaigns often frame gender and rights-based education as something foreign, something, that was brought upon us, something harmful. As a result, even where school programs exist, they're often limited to basic biology or healthy lifestyle courses that many times they shy away from substantive and vital topics like consent, gender identity, or relations. The second thing that I want to highlight is the left behind factor that we see. So who are those people not sitting in those classrooms? Well, they're young people with disabilities, they're youth from rural areas, they're young Roma and other minority groups, they're young LGBTIQ people, young people who use drugs, and increasingly young people affected by humanitarian crisis, such as those millions impacted by the war in Ukraine. Those groups are at highest risk of violence and poor health outcomes, yet they have the least access to information. And the third one I want to mention is about digital shift in our region. If you look at ICA, you will see the highly digitized youth populations. And if young people don't get information from formal settings, they will get it from the internet. And we know the internet is a double-edged sword. It often, offers community, it often offers support, but at the same time, it is full of myth, full of disinformation, full of propaganda, and full of cyber violence and bullying. This is the gap that we as organization, as UNFPA, is trying to step into. And we believe that out-of-school CSC is not a backup plan to, in-school CSC. It is a critical primary strategy to save lives. So when we talk about UNFPA response, we work in 16 countries in our region, and we are guided, and all of our work is guided by the International Technical and Programmatic Guidance on Out-of-School CSC. We're trying to ensure even informal education meets international standards. And when we work on CSC in our region, we use different strategies: digital innovation, peer leadership, inclusion. When we talk about digital innovation, it's basically we're trying to meet young people where they are. And in our case, it's online. When we're talking about peer leadership, we're talking about peer-to-peer support. We're talking about young networks of young people such as YPeer and Teenergizer. We as UNFPA support these youth-led networks to deliver peer-to-peer education in the centers, during the festivals, during the workshops, safe spaces, many different venues. And reaching further is behind. Our programs are a lifeline for vulnerable young people. We use safe spaces for refugees, such as, cases in Moldova, for example, where, they become hubs, not just physical safety, but also information on reproductive health and rights. All of these things, they tell us that actually out of school CSC is also about equity. At the end, it's about a young girl or young boy or young refugee in the shelter, or a young man with autism, or a teenager in a rural village without the school curriculum. And this is about ensuring that they all have power to make choices about their own body, to make decisions, and to live healthy and prosperous lives. I know that I'm out of time, so I'll finish here, but I'm looking forward to further engagement throughout this webinar. Thank you.
Thank you so much for highlighting the topic of exclusion, not only of populations, and thank you for mentioning Roman population, which are not often heard from in many webinars. So it's very interesting that you mentioned this particular group, and also the exclusion of subjects. Young people are learning or not things which they are not interested in. And I think the role that the digital approach is playing is also very important, because it's the changing world that we are seeing. I think that this might be more focused in a given country by Natalia, that I'm asking her to tell us about out of school CSC in Georgia, in your own country. Tell us about your experience, Natalia, please. Thank you.
Thank you. Thank you, dear Esther, for introducing. Thank you, dear colleagues, for inviting and for giving opportunity to talk on this indeed vitally important topic. Thank you to Andrei, who did a wonderful overview from the regional perspective. And let me contribute to his talk, specifically what Georgia and UNFPA Georgia country office and the country itself did and achieved in the regard of the OOC and comprehensive sexual education. So ensuring the healthy lifestyle and providing young people with comprehensive sexuality, reproductive health and rights education is formally recognized and endorsed through the Georgia's state policies and sectoral strategies. Moreover, we had an opportunity that we have an international commitments, including its obligations under the international human rights treaties, and which place a very clear responsibility on the state, which is very important, to take a leading role in educating the population and young people on these very critical issues, and ensuring to have access to age-appropriate evidence-based information. So transformation of the Georgia's education system started back in 2005 with the adoption of the law on general education and national goals of the general education. And we have firstly introduced the first competency-based national curriculum, and the reforms marked significant shift towards a student-centered education model aimed at equipping learners with the knowledge, skills, and attitudes necessary for lifelong learning, will be civic engagement and professional development. So time to time, some subsequent revisions happened for the national curriculum, further strengthened to this approach to prioritize this different competencies, critical thinking and collaboration and safety and security and other related related to the healthy lifestyle, all these essential life skills that were, this was a cross-curriculum themes across all subjects and all levels in general education. So we have also applied the SERAT. This is an assessment of the Georgia's formal education system using the Sexuality Education Review Assessment Tool, which was conducted just now in 2025. So this highlighted both progress and persistent gaps in the provision of comprehensive sexuality education. So anything we do, it's an evidence-based, and SERAT enabled a structured evaluation of the current status of this comprehensive sexuality education in the schools, facilitated comparison with the previous assessment, and the findings explicitly indicated that these related topics remain inadequately integrated in the general education system, and there is a significant gaps in the national curriculum, in the press service, teacher press service, and service training programs. So about the challenges, we will have an opportunity to talk a little bit later. So important is that in response to these challenges, UNFPA has been very actively engaged to advance the comprehensive sexual education in Georgia. We've been working very actively with the Ministry of Education to advocate for the integration of health and personal safety topics in the formal education system. And what is important, and I made a big introduction to come up to this point, that in addition to this, UNFPA is expanding the pilot school doctors hour programs, you see, to reach students beyond the classes, which includes the 84 or 88 structured lessons plans for the grades starting 1 to 6, and covers topics such as relations, health, personal safety, equality, well-being, all these issues we've been discussing around the ICPD agenda. And UNFPA has also established a partnership not only within the school, but also in higher education system to expand this program as much as possible. So in this part of this initiative, several syllabus have been developed, and one is we're reaching not only the students and the young people, but we're reaching the teachers. We're conducting TOTs and teacher trainings programs to ensure that, first of all, educators are adequately equipped with this knowledge, with the skills required for the provision for delivering the comprehensive sexual education, and integrate these issues into the institutional capacity and make it sustainable in this field. Thank you.
Thank you very much, Natalia. And it's very interesting that how you have linked the role of the formal education system with the need of out of school, and how important it is, and also how you're using tools like the SERAT to try to evaluate and to monitor what goes on. So I really think that what you have presented is it's very similar in many cases to other countries and other regions, in terms of how the formal system is sometimes failing to reach and to teach what is relevant. Thank you, Natalia. And now I turn on to Yana. Yana, you represent a very special population. And can you tell us something about your work with young people? What role do they play in the countries that you work with? Yana, over to you. Thank you.
Thank you so much, and happy to see you all, and thank you for having me. So my name is Yana Panfilova. I'm from Ukraine, but now I'm based in the Netherlands, and I'm a founder of Teenagizer, and really glad to see my colleagues today, Andre, Natalia, and now we live in new era when we can meet each other like this webinar or online. So let me start and a little bit put all of you on the context what we face today. So and also in deeply understand our work, it's important to understand the broader regional context. And Ukraine is not just only affected by war, but also the strong conservative narratives that are actively promoted in the region. including through Russian propaganda. So Russia promotes an ideology of so-called traditional values, which reject sexuality, education, gender equality, and LGBTQI plus rights. And unfortunately, these narratives influence not only occupied territories in Ukraine, but also public disclosure in neighboring countries such as Kazakhstan, Georgia, Kyrgyzstan. And sexuality education is often framed as something dangerous, immoral, or foreign. This makes our work more difficult and at the same time more necessary. Even before the war, comprehensive sexuality education in Ukraine was fragmented and limited. Topics such as concerned sexual and reproductive health, gender-based violence, and mental well-being were either avoided or treated very cautiously. As a result, civil society organizations had to step and provide educational outside formal school settings. Since the full-scale war began, the need of out-of-school comprehensive sexuality education has increased dramatically. Millions of young people has experienced displacement, loss of families, members, trauma, and disruption of schooling. In many regions, access to safe and reliable information has become uneven or not existent. At the same time, risks have increased, like sexual violence, exploitation, early pregnancy, HIV, and serious mental health challenges. Or even now, many regions of Ukraine regularly experience missile attacks on critical infrastructure. As a result, people live without electricity, without water, and without heating for a long period of time, especially now in the winter time. And for example, just yesterday, temperature dropped out minus 21 degrees Celsius. And just yesterday, Russia launched and stopped the the electricity ceasefire and provided the huge attack with the tens of the hundreds of missiles and drones in many regions in Ukraine and attacked the critical infrastructure. So this means that families and young people are trying to survive in freezing homes and just trying to study or not study at all, whilst they face increased risk of the violence, exploitation, health risk. In such condition, access to information, protection, and psychological support, psychosocial support becomes more fragile and more urgent. In this reality, we think that out-of-school and comprehensive sexuality education, not just education, is also about protection, psychosocial support, and human rights response. Our organization, Teenergizer, works with adolescent young people, especially with teenagers, and we do our work through peer-to-peer education, community workshop, and digital platforms like as a social media platforms. We deliberated our work outside the formal school system in order to reach those who are displaced, who are most marginalized, and who do not feel safe in the traditional institution. So, and our approach is based on the three key principles. So the first, rights-based and trauma-informed education. So we talk not only about autonomy and biologically, but also about consent, body autonomy, health, relationship, prevention of violence, and emotional well-being. We just trying to create this space when young people, especially adolescents, ask questions without fears or shame. So second one, inclusion of the most marginalized groups. So we work with internally displaced youth, LGBTQI plus adolescent young people living with HIV or affected by HIV. So these groups often face stigma, exclusion, and for them, out of school of comprehensive sexuality education is sometimes is the only source of respectful and trustful information. Third one and last one, youth leadership and peer education, which is the highly important right now. So young people are not just like only beneficiaries, they become educators and advocates themselves. They design sessions, moderate discussions, and speak their peers in the language of trust. Furthermore, I would like to put one very concrete gaps that we can see in our work concerns emergency contraception. So many adolescents simply do not know what to do if contraception fails, or even if sex happened without protection. So they don't know what the emergency contraception exists, because the background, like historical background and the whole context, what happened right now in each region. So, and how quickly it should be taken or where they can access it safely. Fear, shame, and misinformation dominate this moment. So, and also this leads to another important observation for our work. So girls are more open than boys. So boys always more smiling, and they're trying to avoid this topic. And girls, we see they are more actively ask questions about pregnancy, concern, infection, and emotionally safe. And boys, like particularly, like much less. They do often they avoid responsibility or treat the topic super efficiently. So in Autoscope, therefore, is not just about education and also about changing gender dynamics, helping boys understand responsibility, and helping girls feel entitled to knowledge and care without shame. A major part of our work today happen online through peer-to-peer consultation. So we have 400 counselors, which is the students of psychological faculty or social work. They're providing online peer consultation, and we so grateful to UNFPA that dedicate and support us for more than 10 years, and especially Andre, Natalia, and so many that right now of our webinar. And we also run education, like through platform. We reach the big online campaign. We reach more than 2 million young followers that can ask, and we're talking about the concern, HIV prevention, mental health, and so on. So we also include the short videos and QI forums, using the stories, using the social media as much as we can. However, our work, of course, face seriously challenges. So across the globe, and entered the Trump administration, we see how much the funding are cut, and I think especially UNFPA and many UN agencies right now feel it. Most of them. And of course, there's strong resilience from conservative groups influenced by regional propaganda and traditional narratives, which is the very limited funding for long-term programs, and there is emotional burnout among educators working in our constant crisis environment. So yet, what gives us hope is young people themselves, and we are like trying to settle this one. So it's important that we know that young people, adolescents, want knowledge. They want dignity. They want to understand their bodies, their rights, their relationship, and they want a space where they are listened to, not judged. In Ukraine today, Auto School is not just about prevention disease or pregnancy. It's about rebuilding trust, agency, and self-worth in the generation growing up in the war and under ideological pressure. So for us, Auto School of Comprehensive Sexuality Education is both a public health intervention and human rights response. And finally, if you would like to follow or ask more questions, please, we would be happy. Thank you.
Yana, thank you very much. And thank you very much for giving us a picture of what it means for young people displaced and marginalized by conflict, and what is the role that ideology, imposed ideology, might play on this. And I think that we will pick up this thread again on our second round about, this idea about rebuilding trust and building agency on young people, because I think that we are experiencing conflict in so many parts of the world that this is a major part of the work that you're doing. Now, I will ask Elizabeth just for a few minutes to give us to see what common threads do you see emerging from this region that relates to the rest of the regions that we have worked in. And because I find that sometimes we think that our particular region is very, very isolated and that it does not resonate with the rest of the world. And I find what you have been talking about so similar to my own region, to Latin America and the Caribbean, that it's really incredible. So please, Elizabeth, can you just briefly give us some of your ideas on and thoughts about the subject?
Absolutely. Thank you, Esther. And thank you, colleagues. So fascinating to hear the important and just humbling to hear the amazing work that you're doing. It's so important in Eastern Europe and in the Asian region. Thank you for that amazing work. And absolutely, Esther, you are spot on. I know we're not spotlighted, but I'm sitting here nodding as all of our panelists or my fellow panelists were speaking, because what you all talked about is very similar to what they're doing in East and Southern Africa. It's very similar to what we're seeing in the Philippines, in Mexico, and Latin America, even in the States where I do some work as well. So there are unifying aspects that really goes back to the need for us to share, even informally, what we're doing, because there is so much for us to learn from each other. I so appreciated your lifting up the peer-to-peer approach as well. And I'd like to also highlight, partly because of the work you all are doing and that Jana was talking about, of using technology, because technology in the digital space has shrunk the size of the world, where people are accessing information about sex and sexuality and sexual and reproductive health and gender and all the LGBTQ plus and I plus programming and language and services in ways like we never have been able to before. And as someone asked in the questions, that raised a concern, and it's a rightful concern, of how do we use social media and how do we use technology in ways that ensures quality and accurate information for young people. And that is something that perhaps in the second round, Jana, you could speak to. Many people can go onto social media and say, I'm a sexuality educator, and provide information. And a young person wouldn't necessarily know, is this accurate? Is this reliable? As opposed to it just being interesting and compelling information. So that component of not just using technology, but also teaching young people how to discern what is accurate, and media literacy, but using different kind of media right now. That's very important for both in-school and out-of-school practices. So again, technology, digital space is super important. So that's really something. Everything that is being talked about, there are the unique aspects. So even before the webinar began and our panelists were gathering, I up here in the States, in New York State, was complaining about how cold it is. It's nothing compared to what our panelists in Russia were just talking about, where the impact on young people not being able to go out, being in humanitarian settings in Ukraine, and having the cold have an additional impact. So while there are unique aspects based on geography and based on safety and other things that are going on in the settings, we have much more in common than we have that's different. So I really encourage people to share with each other, not just in our regions, but around the world. And we, as the panelists and as UNFPA and as WAS and other UN entities, would love to continue to play a role in sharing your successes, sharing your challenges, so other people can learn from you. Back to you, Esther. Thank you so much.
Thank you so much, Elizabeth. And now I would like to, before we hear more about each one of you, to turn to give voice to some of the questions that have been posed on the Q&A box, because I think that some are relevant, very relevant. And I'm going to read a few concerns, and then ask everyone to comment on those. Ilya Shukov, our colleague working in Malawi, has some questions for you. For Yana, how do you integrate trauma-informed approach into CSE in Ukraine? Um, we will ask you to answer after we finish the whole round, of questions. Um, to Natalia, which entry points for CSE do you use in Orthodox Georgian society and conservative environment, which is so relevant to many other countries? And to Andre, what is the role of CSE in HIV prevention in the region? Thank you. And I also have some from Kieran J. Main. Uh, she says, he says, I don't know, I would love to understand how the formal CSC and the out of school CSC are integrated. I believe the formal CSC is far more comprehensive. Any one of you that wants to comment on this? And does CSC also address what youth actually encounter? Porn literacy, social media, pressure, etc. And a question for WAS, and we will answer that as well. Does WAS as a global organization work with local governments to improve both formal and out-of-school CSC? And our colleague Francisco Viola from Argentina, he makes extensive comments in the need for social and cultural education, out of school education, which he says implies a failure of that kind of CSC within schools, however we may dislike it. In other words, is there a correlation, or there should be? Wouldn't it be inappropriate to suggest the presence of school-based CSC as an indicator for international educational programs? What I mean is that that WAS could suggest an indicator related to CSC that could be considered as an evaluation factor. Fantastic question, and really very challenging. Can we have a round of responses to these questions that have been posed by our audience? Who would like to start? Yana?
Yes, thank you. So answer to Ilya. So we integrate the trauma-informed approach into comprehensive sexuality education by recognizing that many young people in Ukraine have experienced stress, loss, displacement, and violence. And first, we invest in training educators and facilitators to recognize signs of the trauma, use non-judgment and no-triggered language, and avoid pressure participants to share personal experience. And the second, we create a safe learning environment based on the voluntary participation, confidentiality, and respects. And learners always have to right to pass on questions or actively. Topics are framed around self-care, boundaries, concern, health relationship, and not only around the risk or biology. So, and the third, we include psychological support elements such as emotional regulation experiences, resilient building activities, and skill for seeking helps. And also we train our peer counselors. We also teach them how they should how they should react for the many other requests of adolescent and young people online. And maybe I would like also to share, because I think we never talk about EI, LLM, which is also important right now. I think many of young people right now are using so much. And I think we still don't know how to work with the EI. I mean, like, EI is not about the future, it's already right now. So I think we need to understand how we should implement in our program EI and LLM, and how we can engage the developers, because now there's so many works going on around the world with EI. And I think if we are talking about technology, I think we need to stop talking about the social media, but we have to talk about the EI and how EI should also include and how we can work with developers that they can provide this comprehensive sexuality education. For example, the ChatGPT before, the young people ask Dr. Googles, but now they ask Dr. ChatGPT or others. So that's, I think, for us also the new interesting challenge is how we implement EI in our work.
Thank you very much, Jana, and for introducing this very, very important topic. The digital world is really changing us, and precisely what you're mentioning, it's one of the areas that it's most overlooked and most where young people are turning to for counsel. Recently, I read that many young people now feel much more comfortable with virtual counselors than with real people. Thank you very much, Andre. The very challenging
And
question from Ilya, and how do you integrate prevention, HIV prevention, and the other questions also about indicators. How do we weave indicators into out of school CSC work? Thank you.
Okay, thank you very much, and thanks, Ilya, for the question. I'll try to answer it. And well, I mean, there is an obvious, of course, obvious answer to that is that, CSC plays a big and I would say crucial role in HIV prevention, especially in the regions where we see generalized epidemic and where we see a lot of young people, having new HIV infections. But even if we take, for example, ICA region, I mean, historically, the HIV infection started from the injecting drug use. However, over the last 15, 20 years, we've seen that the, predominant mode of transmission is sexual transmission. And we also see more and more young people getting HIV infections. So, when we're talking about the filling in the gap in bridging the gap in knowledge and skills for young people, we're talking about CSC. When we're talking about, normalizing condom use, we're talking about CSC. I mean, in this region, what we've seen during the last decade is that the knowledge about HIV has decreased dramatically among young people for a number of reasons, for a number of factors, but this is the situation. So with this, of course, CSC plays crucial role as it provides correct information about the HIV modes of transmission. It will also eventually lead to the increased HIV testing among young people as it, promotes HIV testing. We would see reduction in discriminatory attitudes, definitely towards people and young people living with HIV. And of course, what I mentioned, the increased condom use among young people. So these are just, I know I don't have enough time, but I'm more than happy to hold a webinar, which actually would be quite interesting, the interlinkages of CSC and HIV, and how CSC can actually improve the outcomes of HIV prevention in our regions. But I'll stop here, cautious about the timing. Thank you. Esther, you're muted.
Natalia, I think you have one of the
yes,
hottest questions in terms of how do we
indeed.
work in conservative settings, and that applies not only to Georgia, but I think your answer, it really relates to
Absolutely,
what we all have to do
It relates to many
Please go ahead.
countries. Thank you. It's indeed very sensitive and relates to many countries, and especially now, Georgia is undergoing and facing many challenges in this regard. Indeed, we are in very, very conservative environment. So we don't use the term comprehensive sexuality education to our external communication, as this term itself is associated with the sexualities and therefore causes some backlashes in part of our society. So instead, we use the term health and personal safety, and we pack it as in a package of skills and education. This is essential for health and well-being. And under health and well-being, health is still very, let's say, a very marketable term. So, and under this package, we put prevention for violence, gender equality, prevention of STI, abortion, HIV, and etc. And indeed, it works. Out of these project-based activities, when we go to work on the comprehensive sexuality education, time to time we're invited to talk with young people, and youth agencies inviting on the forums and so on, and we're talking about the health and well-being. And the young people find it so much interesting, step by step to engage in this topic. So now this works at this point.
Elizabeth, I think, could you just give us some kind of reflection on this question that you have in what do we do in conflict situations where there is no electricity, where there's and not only in rural settings where there's no electricity, there may be no internet access. What do we do when resources are so limited by factors such as conflict, poverty, etc.?
This is an excellent question that we received in the question box, and this is the eternal challenge that we have, which is how do we reach the hardest to reach populations for the variety of reasons that our colleagues have talked about and what we on this webinar have all experienced over the time that we've been doing this work. First and foremost, Esther, what you're speaking to is the need for, again, I'll go back to my word creativity. How do we get portable electricity to places where people need to be able to use technology? Even when we are able to, or we know that we can reach people with in-person programming, which is something we all on this webinar have experience with, we need to have funding and access and safety protections to be able to access people in these areas. One thing that comes to mind that I think a few people touched on a bit tangentially is this is the reason we need so much more training for other adult professionals and peer educators to be able to do this work. We need more people who can educate young people. So it might not be someone who self-identifies as a sexuality educator, but it is someone who is a social worker or a counselor who is working in humanitarian settings or in very rural communities going around. So if we can do many more trainings of facilitators and future educators, that would be important. Another thing that is important there, that's a bigger question, and maybe Andre, when you do a separate webinar, we can address this there, is do we start thinking about expanding this definition of CSE where people who are out in really tough to reach areas, we understand that we may not be able to do something in a group setting or based on a curriculum, but rather we're providing information and education. How does that connect to and supplement and build on CSE? There are sometimes we have to understand that we're not going to be able to do CSE as it is defined, but yet what we are doing in communities is still very life-saving and life-enhancing and rights-building. And the last thing that I'll comment on, which is very important for reaching people in the hardest to reach areas, and in particular places, humanitarian settings, Ukraine, any other places, Gaza, Palestine, is so important, is in addition to the trauma-informed practices and approaches that we speak about, one emerging concept that I invite people to consider is also trauma stewardship. Trauma stewardship is actually trauma-informed practices that focus on us as the providers of CSE in these very challenging settings. It has to do with our peer educators who are being trained to provide information, who are trained to be trauma-informed, but we need more training to ensure that we as the practitioners are also taking care of ourselves, that we recognize that we can be traumatized, that we have our lived experiences as well. So I think that's how I would respond to that question, Esther. There's much more that needs to be done to build our cadres of CSE providers worldwide. Thank you. Over to you, Esther.
Thank you, Elizabeth. And for a last round, 3 to 4 minutes for each person, because I wouldn't want to leave, this webinar with the feeling that we are in a very challenging situation where there's nothing to be done. So where are we going to move forward in this region on these topics? What are the strategies that we are foreseeing that are important? How can we move forward? Because I believe that we can. So please, Natalia, can we start with you? Can you give us your reflections on where are we going? How are we going there? How are we going to reach our goals?
Thank you for this motivating question, let's say so. Indeed, we're talking about the challenges, but of course we have solutions for these challenges, as well as I talked previously about this, how we're packaging this theme in this conservative environment. So the factors, I can give examples from our country perspective, that from the eastern, from the ICA region, let's say. For us, it's important that this sexual reproductive health and rights is recognized formally. So these facilitating factors that include the formal recognition of SRHR education through the state policies or sectoral strategies, so on, as well as countries' obligations under the international human rights treaties. So this is one. Another is that education reforms, which in our case started back in 20 years ago, definitely made a background and base to strengthen the competency-based and student-centered curriculum. So the reform, and we shifted to promote the critical thinking, safety, skills, and made these topics itself very popular, let's say so, and creating all this enabling environment to implement the comprehensive sexuality education through the different tools. And what is the lessons learned and good practice to share is schools' doctors' hours. It's a pilot, but I have a feeling that it's working well. So as I mentioned, the UNFPA facilitate engagement, also facilitates the progress through close collaboration with the Ministry of Education, expansion of the school doctors' hours programs. And what is important here, that beyond the reaching young people, we're reaching the teachers, we're reaching the doctors. So beyond the peer-to-peer education, we're using them as a people for social changes, you see? So this is a good experience from our perspective as well. And packaging, about which I've talked about. And everything is evidence-based, should be evidence-based, definitely. And SERAT as assessment tools, which gives us very, very clear recommendations about the progress and about the gaps as well. Thank you.
Thank you very much for all these very concrete recommendations, which I'm sure all the rest of our speakers will pick up. But I think that some of them are spot on what we need to do. And Yana, can you give us your perspective of where are we going? What do we need to do? Where should we be heading?
Thank you so much. I know Andre need to go, but maybe I can switch to
Oh,
Andre and then I will also answer it.
No, that's okay. That's okay,
Okay,
Yana.
okay.
Please, I can. I can. Yeah. Thank.
Okay, so thank you so much for this interesting question, for this little bit, I don't know, like how to say, this darkness world, like when some part in America said like out ice, and our we trying to stop the war. I think we have to continue to our approach, like the peer-to-peer education, because we see like how teenagers believe teenagers and believe in better to understand, better to receive the any information, especially a comprehensive sexuality education from friends and from peer educators. We see it's really highly important for them. And also I think it's greatest idea that Natalia mentioned about doctors, because I think we have to talk with the young people at the lesson and trying to show them that it's their responsibility to get information, and it's need to build the trust between doctors and young people. So that's the also nice reason to support this. And also I think the last and most important, of course, trying to work out of the box, because we are working with we know our spheres very well, but I think we need to try to engage and encourage new beneficiaries like business or IT developers, like who working on AI or LLM, and also like other stakeholders. And I think to work with the government is also essential and crucial nowadays. And I think I'm so proud that Natalia is still working in Georgia, knowing the context, what happened there, and like very dramatically changed and shaped in other way, yeah, that the Georgian expected. So I think that's also the great example how we need to be inspired. Yeah, thank you.
can you give us your reflections and ideas about, particularly that from a regional perspective? What do we do? What do we need to do?
Yes, thank you. I fully echo the colleagues and Natalia and Yana what they were talking about. I mean, from their perspective, and I think we also covered some of the obstacles. And I think a lot of times we're focusing on the obstacles and what prevents us from from making and getting the result and forgetting about some of the positive things or trends that will help us to achieve our goals. And here, yes, I want to focus a little bit what some of the things that themes and topics that we are noticing around out of school CSE in this region. So we're definitely seeing a shift where comprehensive sexuality education is no longer just about, biology or prevention. It is evolving, and it is evolving to meet, different realities, new realities, complex realities that young people live in these days. And some of them would be such things as digital safety, for example. As lives of young people migrate online, our traditional CSC topics like consent or violence, they're also being reframed for the digital world. And we need to understand what they are in the digital world. So we're seeing high demand actually for education on image-based abuse, cyberbullying, online grooming, and all of those related topics. Another thing, and I would also echo Yana what she was saying, it's about mental health as an entry point. And of course, it all started with the COVID-19 and with the lockdowns. And then it was, even worsened with the war in Ukraine. Young people are these days prioritizing their mental well-being over the physical health. And we've seen that happening. Out of school comprehensive sexuality education is successfully entering communities. It's reframing itself around emotional intelligence, anxiety management, body image, rather than just, purely sexual health. And believe me, I mean, and we all know that young people will be more willing to be engaged in a session, about healthy relationships and stress management than just simply about the sexuality education, especially when it comes from, adults and grown-ups. Another concept that I think is emerging in this region is the concept of life skills in conservative contexts, and something that actually helps us to move with the CSC. Especially when it comes to parts of Central Asia and Caucasus, the term sexuality education itself can be very politically sensitive and, culturally taboo. Thematic shift towards life education, healthy education, rebranding, basically the context remains the same, but the package is different, right? And we are packing it within the broader themes of leadership, communication skills, future planning, and that actually gains community trust and gains parental trust in the long run. I want to mention inclusion, but in a slightly different way. Mainstream schools often overlook the sexual rights of young people with disabilities. Most of them view young people with disabilities as asexual. So we are seeing that out of school CSC is trying to fill in this gap with different thematic and accessible topics and discussions. And we're moving beyond general inclusion, which is about nothing, to specific tools for specific groups and specific needs. For example, explaining boundaries to youth with autism or puberty to young people with visual impairments. So we have to be very, very specific. And the last one I want to mention is actually about toxic masculinity and about engaging men and boys. And this links us to our work on addressing root causes of GBV. And if, it's not only about empowering women, it's also about changing the behavior of men. And we've seen a thematic focus on healthy masculinity and fatherhood that encourages young men to deconstruct traditional gender norms that are often linked to, manhood, aggression, dominance. That also brings us to the phenomenon of manosphere and its uniqueness for our region and how it actually influences the CSC. But then again, it's another topic for another big, probably lengthy webinar. I want to stop here and being conscious about the time. Thanks.
Yeah, Elizabeth, any comments on your part, please?
Absolutely. I think, again, I'm a nodder, so you saw I was nodding along here. Absolutely. What an important contribution from important contributions from everyone. But Andre, your point about really ensuring that we have boys and young men included, and not just included, but focused on and invested in the gender transformative approaches, that we also, while we are trying to fight toxic masculinity, that we lift up and use as role models the many young men and boys who do not embrace toxic masculinity and use them as role models in working with other young people moving forward. We also want to make sure when we're talking about gender transformative approaches that we are inclusive of all genders. We have many transgender and non-binary young people who are in need of unique aspects of CSC policy and related programming. So this is all very well connected and approaches that I think make a lot of sense for all of us to consider and think about.
Thank you very much for all these excellent reflections. I had also picked from Jana the importance of working with young men and men in general, and not only and not well. That doesn't mean that we do not need to work with young girls and women, but we need to go into this area which we know that has been uh, penetrated by internet in not very positive ways. So this is something that we have to tackle. And thank you very much, Andre. I think it's a topic, a full topic for for a full webinar. So I really appreciate that. And also some of the what you have been talking about, the shifting and the reframing for the digital world. That I think that's one of the most important things that comes up, as well as all these ideas about critical thinking, introducing critical thinking, creating enabling environments. We need to work not only with the people, but with the environment, and we need to think of context. Every time that we discuss CSC, I go back to context. So that brings us to working even environmental issues, social issues such as poverty, um, of course, violence, conflict, etc., and gender in a much wider way. And of course, reaching teachers and other professionals. And by the way, last year, together with WHO, the World Association for Sexual Health, uh, with a group of other medical oriented or health oriented organizations, published a call to action on CSC, which I don't have the reference right now, but I will send it to all of you, because I think that that's something that we need to engage on. Nurses, medical students, uh, all kinds of health providers, recognizing that in our world, not only physicians are being the major health providers. Sometimes it's paramedics or nurses or midwives. So they are very important as well. And of course, thank you for focusing or highlighting in the positive trends. This shows us that we are changing, that as was mentioned, we are evolving, and we sexuality education has had an evolution over the past 60 years, yes, but we are at a major turning point, and this turning point is where we need to work in. And we thank you very much for all you're doing. And we have fantastic response for our audience, because, and one of the most important things that I see, people say, I have learned something, and I enjoyed the insightful presentation. Thank you very much for the work you're doing. Let's keep on doing uh, our work. And again, I mean, not only masculinity, etc., is a new topic, but we have so many different avenues opened by these webinars, in terms of the kind of issues that we should be discussing. I'm very happy to have heard, and I also have learned a lot. So, and I want to learn more about your region. So please stay engaged with us. And Now for the closure of the webinar, I will turn to Renee, but again, thanks so much. I mean, you have been absolutely wonderful in your insights and your outlook on the topic. Renee, can you please give us a closing messages?
Thank you so much, everyone, for joining us. I also want to thank all the colleagues from UNFPA very specifically for working with WAS on a broader project and doing research with us on out of school CSE. We thank you for the support that we've received from UNFPA, and we hope to continue our work together. Thank you to our wonderful panelists. Really, I stand in awe. I learned so much. I'm so grateful for all of you. I'm very happy to see young people like you, Jana, doing absolutely wonderful work. And I can't imagine what it's taken from you to do what you are doing. So I'm sure to all of us, you are like a role model, and we can all learn from you. And thank you to everybody who participated. I can see just wonderful positive feedback. Everyone is saying how much they've learned. So we are just grateful at the end of such a wonderful webinar to be doing the work that we are doing and keeping the fires in our heart burning to ensure that we create a world where everybody everywhere, every time, has their sexual rights and health and pleasure and justice in place. That is ultimately what we all want to see, and we will work and continue to work towards that. Thank you, everybody, for joining. Goodbye.